welcome to the Executive Healthcare Insights podcast. My name is Elliot Sloan with the Macallan Group. Today we have a very special guest, Anita Bradley, the President and CEO of Northern Ohio Recovery Association, also known as NORA. Anita, thanks so much for spending time with us today.
Thank you. Thanks for having me.
Yeah, it's our pleasure. Tell me a little bit about your professional background and more about the Northern Ohio Recovery Association.
I'm a person in long-term recovery. I have 32 years of being abstinent from alcohol and other drugs. And my background is criminal justice and my master's in social work administration. I was going to go to law school. Decided just by default, ended up working in the industry of behavioral health and sort of moved up the ladder and founded the organization 17, almost 18 years ago.
Wow, so you founded NORA.
Yes.
That's amazing. Tell us more about the services your association provides to the community.
So we're a recovery community organization. We pride ourselves on hiring individuals that have lived experience that are also in recovery, some of them with minimal education, just recovery, we call it recovery support coach here in Ohio. Some have entry level counseling skills with bachelor's degrees, master's degrees. Most recently, we've added a medical doctor to help with the opiate prescription medication assisted treatment and nurse practitioner. So we've just have a cadre of individuals that work within the industry trying to look at the addiction from every lens.
Sure. So it sounds like you are practicing the concept of helping people get the treatment they need and then inspiring and encouraging the students to become the teachers.
Absolutely. Yes, that's it. I believe when I founded the organization that the healthcare industry put a lot of dollars and effort into the medical aspect. And addiction is medical as well. It's a brain disease. And so I felt like the industry was underfunded, but people in recovery in Ohio, we have one of the largest recovery communities in the country compared to other cities based on the per capita number that's in each city. And so individuals just love to give back. They love to help. And why not? We started out using individuals as volunteers, and then later on, it became like a entry level paid service. But I think if there's some value there, why not support other industries that are really struggling with how to handle and manage addiction and mental health, the illness.
Sure. Yeah. So tell me what uh, separates Northern Ohio Recovery Association from some of the other facilities. Is it a brick and mortar?
When you say brick and mortar, what do you mean?
Like, do you have one campus, one
Okay,
facility?
actually,
Um,
yeah, okay. So we
or is
have
it more of a network of professionals? Because when you hear association, it's a little bit different than
got
the
it.
Northern
Yes,
Ohio Recovery Center, right? A center
yes,
might be
yes, yes,
different.
yes. We're an association of individuals with lived experience and academic education that apply our personal background to the academic teachings that we received around therapeutic value. So we are an association of individuals, mostly not everyone in recovery, but we have multiple facilities. So we have the facilities, we have group homes where we do recovery housing. We have a recovery house for men. We have a recovery house for women. We have a primary treatment center for women. We also take children. We're doing some in-home therapy with families, prevention work, and most recently, we're going to be doing some more workforce development because the industry is lacking in professionals that are entering the profession.
Sure. And why do you think when it comes to addiction, the it's not an industry necessarily in itself. It falls under healthcare. But why would you say treating patients with substance addictions and mental health issues, for that matter, have been so underserved in our country?
One word comes to mind, and that's stigma. Yeah, it's stigma. It's stigma, and it's also lack of understanding, to a certain degree, lack of compassion. People think it's sometimes within their control. It's a lack of education, lack of understanding, lack of advocacy. No one can, I mean, I think once you use a drug that you can alter your brain, but some people have been predisposed through genetics for mental health and addiction, and they have no control over it, just like an individual that's a diabetic may not have control of the genetic makeup of their body.
Sure, sure. Yeah, makes sense. I think some people have had pushback on the idea that this is a real mental issue problem and it's not a problem of willpower.
Yeah, yeah, I agree with that. So I've been dealing with that for years. That's why, I started out by saying I'm a person in recovery. There's a lot of different opinions about, the illness, mental health, addiction, which comes first. And for some people, it's some people have co-occurring disorder, meaning that they have both mental health and addiction. Some people just have mental health disorders. They start using drugs to help cope with that, later becoming diagnosed. And then you have people like myself who strictly was just became addicted with no onsets of mental health personally.
Sure. Tell us what you've seen with how the pandemic has exacerbated the use of drugs and alcohol.
Yeah, so I mean, it has been taken a toll on the industry in several ways. I mean, we see more depression, we're seeing a lot more anxiety, a lot more stress. It's just the last couple of years has have impacted our workforce. Where the industry is suffering because we learned that you can work from home. Luckily, we have telehealth and Zoom and things like that. We were able to reach out to our clients, but it's going to take some time for us to recover. But the impact, we're definitely feeling it. And I think that we need to be proactive in terms of putting resources and education in place. And just, I always say, out of the box interventions for an illness that is out of the box. It's nothing nicely, neatly packaged up, so we have to think about, just meeting people where they are, and that's what our organization does. We try to meet people where they are. Move away from acute care, saying that individuals should recover in certain periods of time because everyone is different.
Sure. So you're customizing the treatment programs to allow your patients where they're not even actually having to come into your facility every time they need treatment.
Yeah, that too, but customizing it in terms of not putting program rules around, this is a 90-day program or this is a 60-day program. It really should be individual program based on the need of that person. We have different levels that we can walk people through, but some individuals have used for years. They may have more trauma in their background and just all these other factors that are not necessarily surfaced on day one or even week two. Sometimes it takes a lot of time and a lot of relationship building to be able to get individuals to open up enough to help them sort through their issues so that they even have the willingness to recover.
Yeah, I've heard someone once say with people with addiction, whether it's drugs or alcohol, the drug that they're using is not the problem. It's actually the solution that they're using for their problem. The
Mhm.
key is finding out the root of the problem and solving
Correct.
that in a more organic way
Yes.
than allowing the drugs or alcohol to be the problem solver.
Yes.
So
We
I
say,
would
yeah. No, you're absolutely right. We say that the alcohol and drug is a symptom of something else, of a bigger issue most of the time. And once we, as you said, get to the root of it, that's where the breakthrough, the healing, the beginning can start. And sometimes that takes time. Some people don't even realize that the trauma is a real trauma. They're just going through life trying to manage it, and no one has identified this, let's say, this particular verbal, physical, or even sexual abuse has an impact on that individual. And so sometimes it takes a year or longer to even get them to be able to articulate that to a clinician or a peer coach that they trust.
Sure. And I can imagine you see drugs and alcohol affect individuals from all walks of life,
Absolutely.
not just people who are struggling financially.
Absolutely. It does not discriminate against any race, creed, social class. One of the reasons we tried to design our services and recruit peers that have lived experience is because each of our experiences are different. You may have someone from the LGBT community that have a certain set of stressors that need to be dealt with. You may, and someone that is heterosexual may not understand that there's a certain amount of extra oppression that may come from that, extra stigma. Not just that, but ex-offenders, African Americans, the health disparities and social determinants that impact all these different cultures play out. And so that's what makes our service design so important, is because we have to look at people as individual, and there's a lot of layers to unfolding all these things that we're talking about.
Sure. So you're empowering the people you've treated and helped get their lives back to come and serve others. The power of serving is what you've embraced.
Yes, yes, and alignment of whatever the social ill is, alignment and mutual understanding, and not necessarily talking from a hierarchy, even though there is a value in all of these things we're talking about. But this program, our organization, was designed around the value that someone that's been there, done that, really understands.
Yeah, they walked in similar shoes that you walked, and they're willing to pull you out of that wrong path you're going down or have been on. Um, and they have a vested interest because they can feel and see the pain the other person is
Mhm.
going through. It's not just, hey, I went to medical school, I'm a behavioral health or a mental health specialist, and I know how to help you. It's, I help myself do this.
Yes, yes,
So
yeah.
I can certainly do a job of relating with you and helping you learn what worked for me.
Yes, yeah. And especially in an industry that's underfunded, in terms of like our social work and counselor salaries are not at the top of the chart in any way, but the value is times like when I am traveling and I'm at a conference, a recovery conference, and someone comes up to me and say, "You were my counselor 6 years ago, and I am still clean." That's the value.
Yeah, that's what keeps you coming back every day and wanting to
Mhm.
grow to as many patients as you can reach.
Yes,
How
yes.
many patients are you seeing or treating in a year?
We treat a couple thousand a year, but we also so direct services between prevention and treatment is a couple about 2,000, and then our social media network meet can interact with over 7,000 a week. So we send out positive media messages of encouragement and activities through our social media networks, and we're on most platforms.
So you are actually through your Facebook networks and other social media networks and groups able to reach patients throughout the whole country, it sounds like.
Yes, all over the country.
And how are you getting compensated for your patients? Are these insurance based or is there um, cash paying services? What is typical
So
for the
there's a blended funding pool that we have. So we have a variety of funders. The biggest one is the Department of Health and Human Services. We also have contract with the state. We have local grants, foundations. Very few people are self-pays. We get a little bit of that. So we're and even now, like, we're trying to get on medical panels and move towards uh, billing the insurances as opposed to utilizing grants. So sometimes the grant will pick up the cost for someone that doesn't have medical insurance. Luckily in Ohio, we have I forgot what it's called, but basically the opportunity to get insurance is higher than in other states. You can access it, but some people don't have it
But typically, these services should be covered by insurance if they have a plan.
if they have it. Yes.
Got it.
Yeah, if they have it. And it depends. So for instance, if you have a program, we have a residential treatment program, and the people and the children are on the unit, there's some services that the medical insurance won't cover. It doesn't pay for housing. It doesn't pay for food. It doesn't, so the social activities, it won't pay for that. It doesn't pay for transportation. It's certain supplies, it won't, so there's all these restrictions. So what makes my job difficult is trying to balance out the restrictions of what this one won't pay for versus what this one pay for to make a holistic program. It's a lot of work. Yeah, it's a lot of work. It's a lot of hard work, and just trying to make sure everything's separated and segregated appropriately is very important. I've learned that over the years.
Yeah, it's a big puzzle you're constantly trying to re-put together.
Absolutely, and it takes a great team of executives around you to be able to make sure that everything the wheel is turning appropriately, and at the end of the day, that the clients are getting the services they need. So I'm a big advocate for certain things that are happening in the state and even across the country because I understand what it's like to be at the ground zero, but I also understand what it's like to leave ground zero and start trying to work your way up. And there are a lot of barriers that prevent people from getting everything that they need. For instance, you got a person coming from prison who actually needs recovery because if they don't get recovery in housing, they may recycle back. So they come home, they don't have family, they need ID, they need clothes, they need food, they need all these different things, right? And so certain funders don't pay for all those things. So there's limits to what each entity will do. And so again, yes, it's a puzzle.
And what have been your effective ways to attract high quality management level employees during a time with such serious staffing issues?
Well, a couple things I found. I strategically try to find people that have um, compassion for individuals in recovery, that are not discriminating and that are not judging them, that have a good academic background themselves, that have knowledge of the industry, lived experience, or even a family member that have suffered from addiction or mental health, that they understand the vision, the culture here. I've said many times before, even debated with certain individuals about the culture of the organization. Was It was intentional that we had individuals that when someone walks through that door, that they felt as if they were being accepted and not judged. And so that's intentional because they can go get health care from certain places. We had a guy in crisis that lived about 50 miles out, and he had left the organization, but when he came back, he was in a crisis. But even in his crisis, he felt comfortable enough to come to the door, and we talked to him. The police was with him. There was like officers, and we talked to him for 3 hours until he got into the car and was able to go to the hospital and get the medication that he needed. But that's not, we don't see that all the time, but that's what is important to me, is that we take the time to be able to de-escalate a situation that could have very well been escalated because this person was in a crisis.
Sure. So you really created a culture of becoming a safe zone for anyone and everyone.
Yeah,
Um, Current patients, patients who've fallen off the map for a few years, they should always know they come knocking at the door, someone's going to run and open it.
absolutely. Absolutely. We're still working on it. We're trying to, even like now, we're trying to get a crisis team. I have a hotline after hours where people can call in, but I'm trying to get a team that's actually here second and possibly later third shift that will take those calls and take those crises, because the illness doesn't discriminate against time either. The illness might manifest itself after hours, like 11 o'clock, 12 o'clock at night, 1 o'clock in the morning, right? So, those people are left to other professions, our workforce, I mean, our police force, who may not understand that they're dealing with someone in a mental health crisis or someone that's intoxicated. You know what I mean? Yeah, right. So I think we're at about like 60 right about now, with a bunch of, we've got about ten positions open.
Got it.
Mhm.
Yeah, that's definitely a big size team to oversee. Not
Yeah.
only all the patients, but just even the staff that
Oh yeah. Oh
needs
yeah.
to be beating to the same beat of the drum.
Yeah. Yeah.
So I'm gonna wrap up with this, Anita. We all saw the pandemic impact a lot of families, a lot of deaths, but then we also saw drug overdose rates skyrocket. Um, I think I read that in 2021 there was over 100,000 overdose cases. Um, but it doesn't seem like the media wants to cover it. It doesn't seem like we're getting the financial support to combat this growing addiction pandemic. It's a pandemic in its own.
Mhm.
So, in your professional opinion, how does our country combat the growing drug and alcohol addiction rates? Not defeat it, but how do we actually put up a fight, slow it down, and put it in the opposite direction?
Mhm. So I think there's multiple levels to it. Again, I think we start with stigma, anti-stigma campaigns, educate the public, educate our medical profession, our academic adjunct faculty at the universities, and make sure that that's infused in these curriculums. I think that our law enforcement officials, and I think that our government has a large responsibility to protect our country. I think we need to pay attention to the marijuana, the medical marijuana, and the cocaine that is being put on our streets. I think we need to have very stiff penalties for these people that get caught bringing drugs into our country. I really think that we need to look at it from that perspective. This is a macro level issue, and it's going to take a macro level strategy. The policies around, just like healthcare. There's lots of layers. I look probably should write a book on it, but I really think from a macro level, first of all, let's stop allowing these drugs into our country. Let's pay attention to these people that are, using marijuana and distributing marijuana in large quantities. Not the well, I won't say not the users that are peddling because they want to get a couple dollars to get their drug or more money. I'm talking about these bulks and kilos that are coming into the country, and out here on our street. These are our children. These are our parents, our sisters, our brothers, our uncles, and we need to protect each other, and we need policies that address that, and we need to pay attention and make sure that that addiction and mental health funding, services, and strategies is a priority in our country.
Hmm. Yeah, I couldn't agree more with you that on a national level, we need to figure out where the illicit drugs are coming from and shut that down.
Yes.
And
Yes.
then I think that there is not enough correlation between mental health and addiction. Whereas if we can treat the mental health earlier, then I think we can prevent the addiction down the road.
I agree. And
Um,
yeah, I totally agree. And also teach resiliency skills to individuals because all of us are going to at some point in our life experience a tragedy, a stressor, a divorce, someone dies, someone becomes ill. All those things are stressors. And so our young people need to have the resiliency to be able to walk through life without using a drug to cover the pain
yep,
from what it is they're dealing with, and also diagnose. I don't want to say diagnose and label someone sooner, but recognize the signs and symptoms of mental health earlier and put interventions in place to address those things.
absolutely. Um, when somebody is faced with a tragic situation or a very um, or lots of anxiety in their life, not enough people are trained or understand the skills it takes to actually calm the mind down
Yes,
and to actually realize that your thoughts are not reality, right? If you
correct.
if you tell yourself, "Oh, I lost my mother and now my life is going to go to shambles. She died of a cancer, let's say, and I'm still, a young kid in my 20s. Now, life's going to just get extremely rough for me." That is not the case, right? That is not the reality. So, telling yourself and building these or implanting your subconscious mind over and over with thoughts that are not healthy for our spiritual self, our mental self, our physical self, then unfortunately it's manifested.
You
It's
just told
manifested.
you just told my story. That's exactly what happened to me. It wasn't cancer, but when my dad died. That's exactly what happened. And 4 years later, I said, I got to do something about this. That's exactly what happened. Forgot about all the coping skills that I had. Those weren't being reinforced at the time. So I'm in college. So, what do? I'm partying. And so after a while, I was like, this is just not how it should be. But that's a very, very good point.
We need to get the younger generations to understand how to constantly embed and impregnate their mind with positivity and
Mhm.
really train themselves to know that nothing is out of their reach, regardless of the situation they're in, if they just have that mental stability and really mental strength.
Yeah. Yeah. Exactly.
I mean, look at you. You're running a 60-person organization, you're helping thousands of patients.
Yeah.
The proof is there.
Yeah, it's a lot of work. And I tell you, you were talking about the pandemic. That was at a time when I just was ready to, between that and George Floyd and all this stuff going on, I was like, you know what? I was over it. But I remember I was so isolated, all I could do was walk and go to the grocery store and eat healthy. And I remember thinking about like some of the social movements that happened. I'm like a civil rights era. I was little then, but I remember is that these people went through um, all of these things to help our country be in a different place. And so why not me? And I got myself together and I continued on, and I'm very glad that I did because it's needed. And so now I'm trying to, you talked about my team. I'm trying to train up a workforce to allow me to do some different things
Sure,
from a macro level, from a policy level,
sure.
because the service industry, I tell the younger people coming in, like, we need your ideas and your technologies, all these different, the Gen Zs and the millennials, and I'm on the cusp of of a couple of them, but We need everybody and everyone's ideas to deal with this social and behavioral health issue that we're discussing today.
1,000%.
Yeah.
There is endless work to be done, but with organizations like yours, we're just getting a little bit closer day by day, going a little bit further in the right direction.
Yeah, I agree. I agree. We need to all get on the same page. I'm gonna do my part.
I know you will.
Do
I
my part.
certainly know it. Well, thank you, Anita, for sharing all these experiences and insights. It was a pleasure learning more about the Northern Ohio Recovery Association. Sounds like you guys are moving mountains in the community, so we applaud you.
Thank you so much. Thanks for having me.
Yeah, it was our pleasure. We'll be in touch soon, and the best of luck with changing policies and getting more patients back to the life that they deserve.
Yeah. Thank you.
Have a wonderful day.
Okay, you too. Bye bye.
Bye bye.
Bye bye.